Welcome, welcome, welcome. This is our very first horse owner webinar from the American Association of Equine Practitioners. We call ourselves AAEP. We are over the moon to have you here tonight. I'm Karen Pouts, Director of Education for the AAEP, and I will be the moderator for this session. The American Association of Equine Practitioners is the world's largest professional membership association for equine veterinarians and vet students. And there's a good chance that your personal veterinarian is an AAEP member. One of our primary missions at AAEP is to deliver the latest treatments and research in equine veterinary medicine to our members. And this mission extends to providing quality information about the health and welfare of the horse to the clients of our member vets. So we very much appreciate your commitment to your horse by being here with us tonight. This webinar is entitled Calm Under Pressure, Conquering Equine Emergencies. Our panelist experts on this subject are Doctors Ali Catalino, Raquel Lindroth, and Nikki Scher. Once we get started, I'll let them introduce themselves further. But first, one more quick reminder, chat for chat, Q&A box for specific questions. We'll try to get to those questions, but don't be angry at us if we can't get everyone's question in. Quick shout out to Kevin Hinchman, who is our IT department chair hiding behind the Zoom window. And with that, I think, Dr. Scher, now I'll pass things over to you.
All right, thank you so much for that intro. We are going to start off by doing a short presentation, kind of going over what we think is important in getting prepared for an emergency, and then talking a little bit about the most common emergencies that we see with our equine patients. And so I'm going to start us off and just kind of get everything going. And then I will also kind of round up at the end, and I'm going to go through some of the questions that we got most frequently and try to give you guys some answers. So as Karen mentioned, myself and Dr. Catalino and Dr. Lindroth will be the ones presenting today. And so we'll just kind of dive into it. So we wanted to just talk about AEP a little bit because this is an organization that we are intimately involved in, and we kind of feel like everyone should know about it. But in all honesty, a lot of times when I'm talking to riding friends, they have no idea what I'm talking about when I say AEP. So it is the largest professional member organization for equine vets. When we have our national conference each year, hundreds of thousands of vets are there. So it's a great group, and we kind of have a threefold mission. So one is to better the profession, both for ourselves and for your animals. Two is educating, and not just educating of ourselves, but educating of you guys, the horse owners. And our specific committee that has started this webinar series is focused solely on horse ownership education. So it's a huge part of what we want to do, and we all feel, especially everyone here today, feels very passionately about it. And then our third tier of focus on the AEP is kind of the reason why all of us got involved in this profession, and it's the horse. We want to make things better for all of our animals and patients. And so that's our kind of main focus with the AEP. So now kind of honing in on why we're all here today, the equine emergency. We could talk here honestly for a full day, and it still is probably not going to prepare you for what you're going to see as an emergency with your horse. There is no way around it. Horses will continually surprise us in the kind of trouble that they can get into. So an equine emergency is always going to be unpredictable, no matter how much we try to plan for it. The most that we can do is to try to put a plan into place, whether that's theoretically and just have thought through it or actually putting a plan onto pen and paper, so that when we do get into an emergency situation, we can avoid making emotional decisions. I'm a horse owner myself, and when I've been in emergency situations, despite all my training and all of my veterinary background, there is no way to not be emotional about it because there are babies. So the more we've prepared for this and thought through what our next steps are, we take emotion just a little bit out of it and try to have a kind of logical plan. And then something that we never like to talk about or really think about, I know I don't, but we have to have a budget in place. It's a realistic kind of thought for all of us. And so whether your budget includes a payment plan with your veterinary practice or care credit, which is basically a credit card that you can use for veterinary expenses. There's a few other companies that have similar kind of credit cards for veterinary expenses, but care credit's just one of them. You could have that as an option. Some people will actually set up savings accounts for their animals. And then the other thing that's not mentioned here is insurance. So, is your horse insured? If it's insured, is it insured for medical? Just knowing what you have in the bank to spend on your animal so that when it comes time for an emergency, you're aware of what you can do financially. And then kind of the meat of planning for an emergency, we decided are these three things. So one is having an emergency kit. And in my next slide, I'll kind of go through specifically what's in that. And then we're also going to have a PDF available because we got so many questions about what we should include in an emergency kit. So we really want to provide this information for you guys. If you do a Google search, you're going to find a lot of iterations of emergency kits, but this is just what we feel is most important. And then, probably the most important on this list is what we call a VCPR, so a veterinary client patient relationship. That is going to be the most important thing you can do for your animal in an emergency because then you have a relationship with a vet, and maybe that specific vet is not available because we are humans and we can't be available 24/7. But there's a plan for when that's not available. And maybe there's another practice that covers, or just another vet within that practice, or a referral hospital. And we'll kind of go in through all those in more detail. But having a veterinarian that you see on a regular basis for your animals is the mainstay of that VCPR. And then the third thing that is really important, a trailer access. And there's kind of many components that go into that, not just having the trailer, but also being able to get your horse onto the trailer. And we'll talk about that a little bit more in detail. But these are kind of our three most important things for making an emergency a little bit easier for you. Okay, so this is a really busy slide. There is a lot of things, and a lot of these things you will never use, and we hope that you never have to use any of them. But I kind of grouped them into big categories. The medication category, important thing about this is to discuss what your vet wants you to have available. All vets have different opinions on this. Some of them want you to have a certain group of drugs available in case of an emergency, especially if you're far away from veterinary access, or maybe there's not someone on call 24/7 in your area. So they may want you to have Banamine available versus a vet that can get to your farm within 10 minutes. Probably having drugs on hand is not as important for that farm. Oral syringes are a good thing to have so that if you need to give something by mouth to your horse, there's a syringe that makes that easier for you, because we all know horses are 1,000-pound plus animals and they're not going to make anything easy on us sometimes. And then a medication that I think is good for everyone to have available is an eye ointment that we kind of commonly refer to as triple antibiotic eye ointment. The actual drugs are neomycin, polymyxin, bacitracin. And we'll talk about that a little bit more specific when we talk about eye emergencies. But this is a really safe ointment to kind of apply to any eye. So it's good to have in the barn in case of an emergency. And then the one of our important questions was that was sent in was, what is one thing, the one important thing that you had to choose in your emergency kit? What would you choose? And I pulled a few different emergency vets from different hospitals just to get their opinion. Every single one of them said bandage material. So this list is a little bit long just because the amount of different areas that horses can injure themselves, we all know is many. So depending on where the injury is, you may need different bandage material to provide some compression and maybe stop bleeding, keep it clean while you're waiting for your veterinarian to arrive. So all of these things are things that you can get over the counter. Cotton rolls, vet wrap, a standing wrap, even just a reusable standing wrap, some gauze, nonstick bandages, Elasticon. If you have any questions about what's most important, always kind of going back to your vet and asking them what they think would be good to have is important. And then I'm just going to stick to the grouping categories. The hoof care category is all stuff in case you have a suspected abscess. So depending on what your favorite way to do it, whether you're soaking the foot or putting animal Intex on to help draw the abscess out, these are all the materials that you need. And then wound care, there's a bunch of different kind of wound care items. The most important is having something to clean the wound, either a betadine or a Chlorhex, and then some type of kind of medication to put on it. Alumend or Silver Spray is one of my favorites. It's a liquid bandage. So for those superficial wounds, that's a great thing to have around. But there are other things as well that we listed here. And then just some individual items that are good to have in the emergency kit. Any good horse person, baling twine, the amount of things you can do with it is endless. So always good to have a flashlight, or if you're going above and beyond, a headlamp. The amount of times that I've grabbed this for my emergency kit, even in a non-emergency situation, it comes in handy. Gloves, just some nitrile gloves, depending on kind of what you're dealing with. It's nice to have and help keep wounds clean. A thermometer, it's good to have one in your emergency kit, even if you have one elsewhere in the barn. We all know that they disappear on a regular basis. So just having one you can grab in a hurry. Scissors, bandage scissors in particular, which just have the blunted edges, a little bit safer. A pair of hemostats, a towel or two, and then an instant ice pack. And this is a pretty exhaustive list for an emergency kit, but one that really has come in handy in a lot of situations. And then the kind of the important things to remember are, it's good to have one for the barn and the trailer. Some people do a really good job about switching it back and forth when you're trailering your horse, but if you're like me, you're gonna forget. And generally when you forget, that's the one time you need it. And then restock after anytime you're using it. So try to do it the next day so it's not forgotten, because it's the worst when you had that item in there and you used it and you go to grab it again and it's not there and you really need it. So again, this will be available as a PDF for you guys. And then also, like Karen said, the slides will be available after this presentation.
Thank you, Dr. Scherer. That was great. My name is Dr. Catalino, and I'm chatting with you guys from upstate New York. I see a couple people from around here popping into the chat, so great to see you. I'm going to touch base on this veterinary client-patient relationship that Dr. Scherer already mentioned. This might be the most important part of this whole presentation tonight, with the changing just the changing of guard that's happening in the equine veterinary world right now. We have a lot of older practitioners that are retiring and not as many newer practitioners kind of dumping into the pool from vet school. So it's very important that you have a strong relationship with a veterinarian that you know and trust and that knows your horses. If you are new to horse ownership or new to an area, interview vets in the area to find the best fit for you. Feel free to go visit their clinic if you'd like, or give them a call. It's just so important that you do develop this relationship with a veterinarian. Once you do have a veterinarian that comes out to see your horses, discuss with them what constitutes an active client status, because usually you have to be an active client in order to be seen for emergencies. Usually this just requires a yearly visit with a full examination and routine work. So we do your vaccines and we check your horse's teeth and, do a full exam and talk about their needs for the year. Discuss with your regular veterinarian as well if they do see after hours emergencies. This is more important for people that use solo practitioners because, again, we are humans and we need a break at the end of the day sometimes. So it's not fair for the solo practitioners to be on call 24/7, 365. So if they are out of town, is there another practice that's covering for them? And who should you call in the event of an emergency if they're out of town? Then there are some veterinarians that will not see non-client emergencies. So again, just driving home that you should have a really strong relationship with a veterinarian so you don't end up in a bind where you need a vet and there's none that can come out to see you. We are moving into a world where there's some more co-ops that happen for emergency coverage. Just know that your veterinarians have vetted out, no pun intended, the person that's going to be covering and that they're working with. So they trust the person that is going to see your patient after hours, and they would probably have the same veterinarian see their own horse. So if it's not your vet that comes out at night, they will be in touch with your vet probably the next day. The main thing here is to make sure that you know the emergency policy and how to contact your veterinarian in the event of an emergency. Do you call the regular office line that you would call for vaccine appointment? Or is there a separate emergency number that you should call? Also, your practice might start utilizing a telemedicine triage service. And if that's something that they do use, maybe discuss with your veterinarian at the next regular appointment how that's going to play out for you. Next thing, as also a fellow horse owner with a horse that doesn't always love to get on the trailer, we need to be prepared to travel with our horses. If our regular veterinarian is not available and we have a dire emergency, or if you're in an area where there's not good coverage and you'll need to hop your horse on a trailer and get him to a referral hospital for any treatment. So it's really important to have a list of trailers that are available to you. That might be your own truck and trailer, or it might be a couple of friends that have a truck over here and a trailer over here, as long as you have a plan for it. And then it's important to practice loading with your horse in a low stress environment. Horses will always call our bluff. They know when we're stressed. And they'll ask us a question about whether or not we actually want them to get on that trailer. So it's a good foundation if your horse knows how to load well and practice loading in the dark. I saw a comment come through the chat that emergencies will always happen after hours, and that means the sun is also down. On the bottom here, I just have a couple points on when you might want to haul your horse in if you can get more prompt service because the veterinarians are already in-house. If you need further advanced diagnostics, maybe radiography is not available in the field, or your horse needs to be monitored after hours, you might haul them to your regular vet. A referral hospital is always an option after you've spoken with your regular vet, but might be the only option if you need surgical intervention. And again, if your horse is in a dire emergency, chatting with your vet on the phone and heading straight to referral might be the best option as well. This one is a little bit of a shout out to us vets, but we want to help your horse. And in doing that, sometimes having an area that is dedicated, we're not going to trip over buckets or brushes so that we can actually spend some time examining your horse thoroughly. Electricity is not always possible, but flashlights are nice to have around. Having a quiet place to treat your horse that's out of the elements, a 3-sided shed is good enough. Warm water is not something that we can always have, but it is nice if you can haul a bucket out from the house for us if we do have to tube your horse or rectal them on a cold night. Having a treatment stall or an area that we can work is very important, but stall rest might become a necessity for your horse. And do you have a plan for that? If it's not on your property, do you have a friend that has an area where you can stall rest a horse for a period of time, or can we do a makeshift stall rest paddock? Also, is there something that you can hang above a stall if we need to run IV fluids on the farm? If you're dealing with a colic, we can rig up, hooks above stalls pretty easily, but it's nice if it's been thought out in advance as well. Something that a lot of clients don't think about, but I assure you your veterinarian is thinking about, is will the driveway be plowed at least enough to get through? And is the driveway well marked? A lot of rural properties don't have well marked driveways, and that just adds more time if we have to stop and call if we're at the right property. In advance of an emergency, you should have all the information that your vet needs prepared and written down, either in a binder or tacked to your horse's stall. Owner information is, of course, important. It's going to be the first thing that we ask for, but the second thing we'll ask is everything about the horse. We're going to need the current address of the horse. So if you board the horse, make sure that you know the street address of that barn and have it handy. Whoever calls in the night of the emergency needs to know some relevant history of the horse and their age. So if that's going to be a barn owner or manager, just make sure that they kind of have an idea of the horse's relevant history. Which reminds me that we should also have an authorized agent if we can't contact the owner, or if the owner is out of town. This might be the barn staff, and it might be that they're your authorized agent all the time, and sometimes it's just if you're out of town. But the important thing to think about with this is, are they authorized to make a euthanasia decision, which is nothing that we all want to think about, but it's nice to have it planned out in advance. If you have your horse insured, this person might need to be approved by the insurance company. And to touch base a little further on what Dr. Scherer already mentioned, think about a budget for treatment in advance as well. And if you have a few horses, it's okay if the budget for treatment is different for each horse. It's okay if your really old guy is going to just get supportive care on the farm, and if your young performance horse is going to get hauled directly to a referral hospital. It's also okay if both of those same horses get the same budget and the same treatment plan, because age is not a disease. But in advance of an emergency, you do want to know kind of your plan. And again, for those horses, is surgery an option if they need it, both financially, and can you work with that horse in recovery if surgery becomes an option? Is your horse insured? Should you look into insurance for your horse? There are many, many options for insurance in the world right now. Some as easy as giving your horse a supplement every day and making sure that you have a valid VCPR and they're up to date on routine care. Then you'll get this colic care coverage where a certain amount of money will be given to you for colic care if you need it. This list of resources, it's interactive, but it will be given to you after the whole presentation is recorded and sent over to you tomorrow. We've compiled some really important information here for you to read over after the fact. The first one is the Equine Effective Care Guide, which the AAEP just recently published, and it goes over how we can work together as horse owners and veterinarians to provide the best care for our equine patients. The second one is a guideline for equine emergencies, which is just a written up sort of version of what we're talking about tonight. I did add in the foaling mare guidelines because it's foaling season. This is an AAEP guideline, and it goes through, it's just a short little read, and it goes through what you can expect if you have a foaling mare on the property, a quick little stage 1, 2, and 3 of labor, and then the benchmarks for a brand new foal. Probably my favorite two things on this slide would be the Find a Veterinarian link. If you are new to an area, if your veterinarian retires, if you're traveling and you need to establish a relationship with a new veterinarian, this link will help you find an AAEP veterinarian in your area. And lastly, go ahead and follow the AAEP on social media. We work really hard to provide you guys with resources that are relevant and updated. We also we send out a whole bunch of information based on what time of year it is, you know, if it's spring and foaling season or if it's summer and we're into the thick of, you know, sport horse season. It's all on there for you and it's easy access. And with that, I'm going to hand it over to Dr. Lindroth.
Greetings from Aiken, South Carolina. Dr. Scherer, Dr. Catalino, thank you for your excellent presentations, and I welcome your input as we go along. And so I consider myself the campaigner of the group. 30 years, a horse veterinarian. I also call myself a hybrid because I've been there in the field as a general practitioner. My special interest is equine reproduction, and I've also been an educator as a clinical instructor. Right now I'm at Lincoln Memorial University. I understand our student AAEP chapter has joined up, so I send a virtual wave, but I'm excited to be here with all of you. So we're going to shift gears now and discuss the most common equine emergencies. And I will remind us that I'm not going to go into the detail of the diagnoses of these conditions or the treatment plans. My goal is to help you as the horse owner recognize symptoms and recognize the status of your animal, and then be able to make an appropriate response in working with your veterinarian. Dr. Catalina, if we can go to the next slide. I will frame this discussion with my bias as a reproductive veterinarian. So here is Artie on his first birthday. And I've known him, or I knew him from his first ultrasound at 14 days. And so the horse owner, Carla, she and I had at least 11 months to anticipate this event. And with this, we all have that goal of a successful outcome. There's, in this case, a lot of investment of time and resources and emotion, and we are all working as a team for that live foal that's vigorous and off to a good start. So here I really want to emphasize the value of the partnerships that we establish. I love to collaborate with my clients, and I consider the partnership a mutual responsibility that we share in the care of the horse. I see myself in the role as a medical advisor, and I respect the role of the client in being a responsible owner, decision maker, and guardian for their animal. And I think it's very important that we share decision making. I help the client make informed decision, and that we prepare together for those successful outcomes or the unexpected emergency. And so if we can go to the next slide. When I partner with clients, I'm helping them prepare in advance. And I think that, again, emphasizing the value of the relationship, if I'm working with a partner that I know well, and the client has trust in my competency and my relationship with them, our ability to make confident decisions is just much more easy. A lot of these things happen in advance. As a reproductive vet, I usually schedule a routine exam 1 month prior to the foaling event, and we can have strategy talk. So with that, we talk about the roles each of us will play, the expectations with the communications. We usually develop a plan A, but I also advise coming up with a plan B and a plan C for those unexpected events. But I help educate the owners in terms of understanding the clinical signs as we're coming closer to foaling. We make sure the environment is prepared, that we have a clean foaling environment. The communication systems are in place. The client would know exactly how to find phone numbers, when to call, what to expect in terms of the communication systems. All of this is planned in advance. I like to make sure, again, that we have equipment available and that the foaling kit is there and ready. And I think it's important, again, this is just emphasizing what has been said before, being response able, having things prepared in advance. So much of the successful outcome happens because we've been able to prepare in advance. Okay, next slide. So when we're in the response, this is when the plan goes into action. And with foaling, oftentimes I remind my clients to relax and enjoy its nature's process. And 90% of the time it goes as expected. But the clients have been prepared to respond in a timely way. They understand when to communicate and what information to communicate. But again, this is where we can have an effective and coordinated response in the event. Now, I think what's important is if you've rehearsed a plan and something unexpected happens, then you're able to have more clear and let's say non-emotional, but much more clear thinking and much more capable in your response. So let's go to the next slide, because I want to help the clients be able to respond in the unexpected event, right? So we've communicated in advance. What would be the signs and when would you communicate in a foaling event? And I help them understand anything abnormal about presentation requires a phone call. So a foal should be delivered in a diving position. And if you were to see, for example, hind limb presenting first, that's an immediate phone call. If labor was being extended greater than 30 minutes and you did not see progression, that would also require a phone call. And then I prepare clients that there are going to be times where they have to be bold. A red bag is a situation where the placenta is separating prematurely. The foal would not be receiving blood supply or oxygen. And in that case, a client is going to have to cut open the placenta and try to deliver the foal as soon as possible. But again, being prepared for the truly urgent situation, we're going to be able to, the client you're going to be able to think more clearly if we've gone through a plan, rehearsed the plan, and then you know how to respond accordingly. Okay, next slide, please. And a lot of what we're trying to determine is the timely response. And when in a newborn foal, for example, I share with the clients my 1, 2, 3 rule, that the foal in 1 hour should be standing, by 2 hours should be latched onto the milk bar and nursing, and by 3 hours, the mare should pass the placenta. And if the foal is not meeting those benchmarks, or the foal is not showing a strong vigor or a strong desire to find that milk bar, then I need to be coming out sooner. But otherwise, I could be making a same-day visit for the newborn foal. Okay, next slide. Now, I've used that as kind of a framework for discussion as we're now going to showcase other equine emergencies. And I just want to recognize upfront, again, our goal is to help you recognize symptoms and be able to respond accordingly in a timely way. You would be working with your veterinarian directly to determine what responses are going to be necessary in your situation. So these are guidelines. And again, I encourage you to work with your veterinarian to determine how you're going to respond appropriately. And I also want to stress that in my relationship and working with clients, I have the confidence that they know their animals well. You are all keen observers of your horses. So when you tell me something's not right, I believe you, and we're able to move forward confidently with our decisions. Okay, next slide. As horse owners, I encourage you to be capable responders. And I think the importance of being able to do a TPR is critical. So have the equipment, work with your veterinarian, know how to get a temperature, a pulse, and a respiration on your horse. A normal temperature is going to be 100 plus or minus a degree, so anywhere from 99 to 101. The heart rate of a horse is normally in the 28 to 44 range. If the horse has a heart rate sustained over 60, that's going to be a sign of distress. And the respiratory rate in a horse is going to be anywhere from 12 breaths a minute up into the 20s. But the TPR gives vital information in being able to interpret the condition of the horse and determine how a response should be decided. Next slide. Okay, let's enter into this discussion. Colic is still the #1 reason, right? That we all might be meeting in the middle of the night. Colic is referring to abdominal pain, and let's recognize that this was a design flaw with horses, and that that the GI system is a very delicate system, and any condition of colic should be potentially considered as a serious medical condition. But the signs can vary. Signs can be mild from a horse just being off feed and not drinking, or manure production could be reduced. Signs could also be severe, where a horse is rolling and laying down frequently. So next slide. I think what is most important in recognizing if your horse is showing abdominal pain is to intervene early. Blocking the pain cycle is very important with horses that are colicking. Once you block the pain cycle, often their gut motility might normalize, and we want to keep that plumbing working. We want to promote good gut motility. We want to make sure the horse is taking care of itself, provide hydration. And so blocking the pain cycle early is very critical. Now, many times you might be working with your veterinarian, and they may even advise for you to give an anti-inflammatory under their supervision to, again, block the pain cycle. But this does emphasize, again, the value of your working relationship with your veterinarian. Next slide. Now, a grain overload is going to be a medical condition that we need to treat urgently before symptoms start. So the problem with a horse that gets into the feed room and eats too much grain is that grain can cause disturbances in the microbiome of their gut and can lead to consequences of endotoxic shock, colic, and even laminitis. So we consider a grain overload a very urgent emergency where you need to proactively treat the horse before symptoms become consequential. Next slide. Okay. A choke can be a scary presentation. A choke is a medical condition where there is often an obstruction in the esophagus. This can be a food bolus, but often the horse will show signs of gagging or retching, and often you'll see reflux and kind of frothy feed material coming out the nostril. So it can be a little scary. It is considered an urgent situation, and you would, in that situation, want to keep the horse calm. You would not offer any feed or water, and perhaps lowering the head for the horse. Again, keep the horse calm and make sure your veterinarian would be addressing this as an urgent situation. On the right, Dr. Catalino, if you want to advance, on the right, you see an endoscopic view. You could see before that there was the feed bolus, and then it's relieved. So often, we will be treating to relieve the choke, and then assess if there are any complications. Aspiration pneumonia can be a complication of choke. So again, you want to keep your horse quiet, no feed, no water, and perhaps a lowered head. Okay, let's proceed. Okay, as horse owners, we're going to be dealing with lacerations. Horses are flight animals and they get into trouble. So recognizing, I used to have a rule with clients, if the laceration is below the knee or below the hock, let's see it as a more urgent condition. Clearly, if there's a laceration involving a joint or over a synovial structure or close to a tendon, that's going to be considered an urgent situation. The more proactively we can address a complicated laceration, again, we avoid consequences such as infection or damage that could be life-threatening to the horse. So early intervention. A laceration that's on the body might not necessarily be an urgent situation, but should probably be seen within 24 hours. Now, I think this is, again, as a horse owner, to be a capable responder, Dr. Catalina, we can go to the next slide. Often you're going to be responding and applying some first aid. So having your first aid kit ready and available and being able to put an effective leg bandage on a horse, I think is important. So often with a wound, you're going to be looking to protect the wound, immobilize the limb, perhaps clean the wound, and perhaps control hemorrhage. And I'll never forget the story. I had a client call. Her horse had a cut over the fetlock. It involved an artery, and it was significant. So it was pumping. And I said, well, you're going to have to use what you can to effectively create a tourniquet. I showed up within 15 minutes and ran into the barn, and there she was in her bathrobe. And so her tourniquet was to use the strap of her bathrobe and apply a tourniquet on her horse. And I got there and she was like, okay, Dr. Lindroth, can I go get dressed now? So anyway, I was very proud of her. Next slide. Other emergencies are allergic reactions, and we need to assess the respiratory status often in horses with allergic reactions. Keep in mind that a horse is an obligate nasal breather, so they only breathe through their nasal passages. And if there's any excessive inflammation or swelling, and if that becomes restricted, they can go into respiratory distress. So again, being able to recognize a horse that is distressed in its breathing, they may be having nostril flare or labored breathing, a respiratory rate that's going to be up over 30. These would be signs of respiratory distress and should be seen as an urgent situation. Other allergic reactions could manifest as hives, and that's something that could be seen within 24 hours. Having practiced in the Western states, I make a comment too about snake bite, rattlesnake bite. If horses get curious and put their nose down and get bitten on their nose, that inflammatory reaction can happen quickly and their nasal passages can be obstructed. So often you would have to establish airway by either using syringe cases or perhaps hosing to kind of open up that nasal passage and establish airway breathing. So, okay, are you still with me? Okay, strap in, we're still going. A down horse. There could be a few different reasons to have a down horse. It could be a geriatric or older horse that doesn't have the strength or perhaps has some arthritic conditions and is not able to get up. It could be a horse with a neurologic issue or trauma, or it could be an infectious disease. But we consider a horse that's down an urgent situation because prolonged recumbency is not a good thing for horses. They end up, if they're in prolonged recumbency, they can have GI disturbances, respiratory disturbances. So we do consider the down horse an urgent situation. Okay, next slide. Okay, how about the horse that you see a lameness unexpectedly and severe lameness, a non-weight bearing lameness, the question is, well, could this be, now in this case, this horse apparently has a nail in the foot. If you were to find that and a penetrating nail, it's recommended to leave the nail in place so that when your veterinarian is able to do imaging, they can assess what complications the nail may have caused. But non-weight-bearing lameness could be a foot abscess, or it could be a fracture. And again, an urgent situation. A horse that's showing lameness at the walk, you might be considering in a same-day appointment with your veterinarian. But on the next slide, I'd like to share a success story. So Ashley is a good friend of mine. She is a very competitive eventer. And she called me. She had gone out and her horse Jolie was non-weight-bearing lame. And Ashley was very capable in her response. She knew how to do a TPR. She called and said, Jolie is not walking well, and her heart rate was sustained in the 120 range. So her horse was clearly in distress. With that information, I knew that we had to see the horse right away. I asked her to just keep the horse calm and in place, and we were able to take the digital radiograph out there and diagnose a non-displaced tibial fracture. With that information, we were able to restrict the horse's activity in a stall and keep the horse on a high line for months, and we saved Jolie's life. They've gone back to competition. But the reason I bring this forward is being able to communicate with your veterinarian and equip them with the TPR information was a very important part of that decision and a very important part of our management decisions and the successful outcome. Okay, we'll carry on. Now, a high fever, this should be considered an urgent situation, but could represent an infectious condition or a critical medical condition. And often we're going to come and interpret the signs of the horse to determine which system is affected. Is it a respiratory infection? Could it be a GI infection or complication, neurologic? But often you would want to be isolating this horse from other horses in case there was an infectious condition. But a fever, and again, a reminder, when you're doing that TPR, anything up over 101 would be considered a fever. Okay. Next slide. Okay, acute diarrhea. So with diarrhea, the question is it a sick horse or is it a nutritional disturbance? Again, being able to do the vital signs and take your TPR will be important to discern how we need to proceed. So if this is a sick horse and they have abnormal vitals, that's going to be more concerning. And we'd want to be monitoring, is the horse hydrating? How frequent is the diarrhea? And again, being able to recognize the vital signs is important in decision making. Now, a horse that's going through a nutritional adjustment might not be as urgent, and we could see within the same day. So again, I would be partnering with you to determine kind of the urgency of the matter. Next. All right, here's a good picture. This is a horse with swollen leg and cellulitis, and this should be seen within the same day, possibly to be reducing the edema as well as possibly antimicrobials. So next slide. Okay. A horse, especially if they're a breeding candidate or a stallion, if they were to have any kind of prolonged erection or inability to retract the penis due to an injury, perhaps, this could cause long-term trauma to the penis if they're not able to tuck it home into the sheath and protect it. So any horse that can't retract the penis back into the sheath, you want to prevent any more swelling or dependent edema and make sure that the penis is protected. So that would be considered an urgent situation. A few final slides. Okay, eyes. I consider eyes very delicate. So any eye problem would be a same-day visit, especially if you see any ulceration on the cornea, and a treatment plan should be applied within the same day. Okay. So in summary, I would like to bring forward 3 takeaway points. I think it's critical to establish partnerships with your veterinarians and build the partnerships so you can be making confident and trust the veterinarian you're working with in making decisions. Secondly, I think it's very important to plan ahead and know in advance how you're going to operate with a plan A and potentially a plan B or C, but be able to work and prepare in advance of the emergency. And thirdly, become a capable responder. Know how to do that TPR. It is very important in the assessment and the decision making. So I know not all emergencies have a successful outcome, but most often with advanced planning and being prepared, we can all optimize that chance for a successful outcome. So here we're celebrating Artie's win. It was quite fun. He became a world champion in his jumping division. So with that, I thank you for your attention, and I believe we now can open it up for some questions in the remaining few minutes.
That's right. And we can run overtime. I've never known one of my vet webinars to finish early. We have lots to talk about. So those of you who are able to hang on, go ahead and hang on, and we'll spend some time answering questions. And again, and I'll pop it in chat again, we'll have the recording of this session plus other resources available to you on the AAEP website. I'll post that link in just a second. Give me a day or two to get that video rendered and posted, but otherwise that stuff will be available to you again. You might also notice that in the title card, the thing that says Calm Under Pressure, I have both that website address and an email address. So we're happy to hear from you with that email address. Okay, so Dr. Scherer, I think I'm kicking it back to you for questions. Is that right?
Yeah, exactly. And so I've kind of organized these questions into some groups because there was a lot of similar questions that popped up. But I wanted to start by just explaining a few things that popped up in the Q&A while everyone was talking. One is the definition of TPR, and it just stands for temperature, pulse, and respiration. So those are the vital signs that you can take and have that information to give to your vet to help decide how urgent the emergency is. And then the other thing that I thought was a great question is what would be required to have someone else make medical decisions for your horse? And it differs for each veterinary practice, but the majority of them are going to have something that the owner needs to sign in order to give consent for another person to make medical decisions for their horse. And most veterinary practices have like a standard form that can be signed for that. But yeah, so just ask your vet and they should be able to get you the papers that you need. So the first kind of section is difficulty in finding a vet or emergency coverage. So with the veterinarian shortage, especially in rural areas, how can horse and barn owners manage anxiety even without having an emergency necessarily? Basically, how do you kind of prepare for maybe not having a vet be able to come out to your barn right away? And, we've kind of talked a lot about this, but basically having a plan with your vet. So maybe they're not able to get there within the hour, but what is the next step? And sometimes that next step is going to be to put your horse on a trailer and take it to the nearest referral clinic. And if that's what it is, you just have to be ready for that. And I would say, because I know that there are vets out there that don't have a plan for emergency coverage. And I think the majority of us strongly feel that most responsible vets will have a plan for that. So if if your vet doesn't, then knowing the nearest emergency clinic that you can take your horse to is the next step. And just kind of preparation is the key. So while you're waiting for your vet to come, because a lot of times there's only one vet on call, maybe there's multiple emergencies, staying calm is kind of the first thing. If you need a friend there helping with the horse, or maybe just for moral support, call a friend, have them wait with you. If your horse is colicking, you can do a little bit of walking, but you don't want to exhaust them. So it doesn't have to be a constant movement thing. You can take the TPR, having multiple TPRs while you're waiting, maybe even give your vet some more information. And then the other thing that may be helpful is taking pictures, especially if it's something like a wound that can help your vet decide how quickly they need to get there. So having multiple angles, and that is something that with iPhones, luckily, most of us can do pretty easily. Someone asked about a list of emergency equine clinics that perform colic surgery. I wish that list existed, but it doesn't. One thing that you can do besides just Googling all of the kind of vet hospitals in your area and then calling and asking if they do colic surgery is also asking your vet, because they're going to know the people in the area that are able to do surgery like that. And then as an equine manager of a barn with 13 horses, what is the best advice you could give me for caring for these horses to the best of my ability in an emergency situation? I think when you're a manager and you have multiple horses, they're going to have different veterinarians. They're going to have different emergency contacts. Maybe some will be insured, some won't. So just having a folder where all of that information is kept, and maybe even laminated cards, so that if the horse has an emergency, you know exactly where to go and find out who needs to get called, because maybe you're not going to be able to get a hold of the owner and you need to know who the second contact is or who the vet is to contact. And then another question is, are there situations where it's better to immediately give a pain reliever, or do you always wait for a vet? And honestly, that really depends on the injury and your vet's time frame. Sometimes if a vet is with multiple other emergencies, they may instruct you to give some medication before they arrive, but at least call, have a talk with them, and they can help you decide if you need to give something right away. And then the kind of thing that we don't want to think of, but is sometimes necessary, is there a necessity to field euthanize? If there's a necessity to field euthanize a horse, what method could be used? Specifically in a trail situation where a horse is a long distance and maybe has some type of catastrophic fracture. A gunshot is an AEP humane method of euthanasia. Obviously, we are not suggesting that an owner does this, but the steps would be first call your vet, have a discussion with them, and then the local police are authorized to do this. You can also call a local referral hospital. Sometimes they'll be help over the phone, or even to law enforcement that maybe don't have experience with this particular situation. Ideally, though, a veterinarian would be available even before this method of euthanasia. Ideally, sedation would be given. So really involving your vet would be your first step. And then you can call authorities if that's not an option. Another question was, when trail riding, what are good medications to have besides just Banamine and Bute? And I thought that kind of tied a little bit into this question, where if you're going far out in trail rides and you know that it's going to be quite a ways away from help, if something catastrophic would happen like this, having some type of sedation option to keep the horse comfortable while you're waiting for help is something you can talk to your vet about as well. And then kind of focused on the emergency kit. We got a lot of different questions about particular items. Again, Karen's put the link in the chat as a PDF, and then it'll also be available on the AEP page in the horse owner section. And the trail ride, an emergency kit for trail riding is going to be minimal on the bandage material and hoof packing material, just because you want it to be light, something your horse can carry. So maybe just choosing kind of one bandage option with an ability to, kind of wrap would be a good choice. And you could either use it as a leg wrap or a hoof wrap. The specific questions about items, a hemostat, that's something that can be purchased on Amazon. Can sanitary pads be used for bandaging? They absolutely can, and since they're absorbent, they're good for bleeding wounds, but keep in mind that they're not sterile. So it's definitely not something that should be bandaged long term that way. Thermometer, about a specific kind of thermometer. The quick reading ones are my recommendation, only because the ones that take a long time, sometimes you have an uncooperative patient, and then your reading's not going to be accurate because of that. And then about a stethoscope recommendation, it doesn't need to be an expensive one. You just need to know how to use it effectively, so where to place it so that you can hear a heart rate. And your vet can show you that when they're out for like a routine visit. And then a lot of questions about is there any type of pre-made emergency kit that you can actually purchase? It absolutely, there are a lot out there. Just in kind of a quick poll of people and searching through the internet, SmartPak has different size kits. The large trailering kits seem to have everything in it, but there were smaller kits for trail riding and things like that. So the SmartPak's always a nice company that can get things to you quickly. So that's one that I would have a look at if you're interested in just purchasing a kit. I already mentioned before that most valuable tools to have an emergency kit, the majority of us feel like it's probably bandaging material. And then what are 3 things every barn should have in the event of an emergency, but commonly don't? And I kind of asked a lot of people about these. A ready-to-go truck and trailer was kind of the top of the list, because oftentimes people have one, but maybe it's going to be not there at the moment, or the truck's not there. So just having a way to get the horse somewhere. The laminated list of an emergency contacts that I mentioned before, and just a general first aid kit. Another thing that was mentioned a few times, just having electricity option. So if your vet comes out and needs to take a radiograph or something like that, having the ability to plug in the radiograph machine is really important. And then a few questions about equine first aid courses, which honestly I didn't know was something that existed, but there are so many online when you go and look, and it is really hard to tell which ones are worthwhile and which ones are not. RACE is a specific organization that approves continuing education credits, and these are required for both veterinarians and veterinary technicians. So a lot of these equine first aid courses were marketing RACE approval. So those would be the ones that I would recommend. That means that they've gone through some type of kind of check and balances process to make sure that the information that they're giving is worthwhile and correct. Just a few preventative questions to kind of hopefully avoid emergencies. What should be done at yearly exams and to ensure precaution, prevention of emergencies. Just in general, vaccines, fecals to screen for parasites and help you determine how often deworming is needed. Routine dental exams. One of the big things that can be prevented just by having dental care is choke, which can be really a frustrating emergency for everyone. And then for our older horses, Cushing's testing can avoid a lot of emergencies down the road. And then another question specifically about Cushing's horses and in the heat. And kind of what you can do to help prevent any heat issues, clipping if needed, soaking the feed, making sure they sweat properly, and misting fans can be hugely helpful as well. Benefits of wetting grain for horses, just prophylactically, decreased dust for horses with allergies, increased water intake, and reduced choke risk. Specific emergency questions, which I think Dr. Lindroth did a fantastic job of answering. But what are some major medical emergencies owners need to watch out for? The list can be overwhelming, which we completely agree. It's overwhelming for us sometimes. Honestly, just knowing your horse, don't get held up on all the specifics of emergencies. You know what is normal for your horse. And if anything's abnormal, like Dr. Lindroth mentioned, we trust you. And if you call us and tell us the horse is not right, we're going to take it seriously. If a horse is suddenly lethargic on a trail, it doesn't seem right, what do you do? The biggest thing would be dismount. If they're not feeling well, they don't need to be carrying you around. And then going back to our TPR, so taking the temperature, pulse, and respiration, and then calling your vet for the next steps. A few questions about disaster preparedness, and that is on our list for webinars to go kind of hopefully aim for in the future. So there will be more information on that. There was just way too much in this to cover to even kind of get into that. So I don't want to not do that justice. A few questions on colic. Again, I'm going to circle back to that temperature, pulse, and respiration to have that information to give your vet. Another important thing is checking the color of the mucous membranes. They should be light pink. And if you're seeing a white or a dark red, those are things to mention to your vet as well. How old is too old for colic surgery? Honestly, there is never a too old for colic surgery. It's a personal decision for you and your horse. I've seen multiple successful surgeries performed on horses in their 30s. So there is no too old. Dr. Lindroth mentioned this as well, but for eye injuries, what should happen? And a vet should see them that day. Eye injuries can be so easy to fix when seen early and so disastrous when seen late. Another question about how to prevent hoof abscesses, which can be so painful for a horse, avoiding turning out in mud, and then circling back to that Cushing's testing, because we know that untreated Cushing's can predispose a horse to an abscess. For leg wounds, what do I do? Do I hose it off? And the only situation where we would suggest not hosing a leg wound is in an area with pitheosis, which is going to be the southeast. You can ask your vet if you're not sure. And then for a bleeding wound, you can hose it initially, but then you want to bandage it. Bandaging is going to compress that area and be the quickest thing to stop bleeding. Another question about laminitis. What do I do in acute laminitis? Definitely call your vet. You don't want to do any unnecessary walking. Put them in a stall with deep bedding. And then depending on when your horse can come out or when your vet can come out to see the horse, maybe even talk to your vet about doing some icing protocols. Is there a difference in common emergencies in horses versus mules? Not that I'm aware of. They can get the same exact things. In general, mules are very tough animals, though. So if a mule looks like they're in pain, generally we take that very seriously. Another question about walking. I kind of already mentioned this, but you don't want to walk them to death. You want to walk in moderation. If the horse is trying to lay down, don't put yourself in an unsafe situation. It is always fine to put them in the stall. And then a couple questions about choke, where a horse can get food stuck in their esophagus. The goal is to get them to relax, maybe even drop their head, but above all else, you just don't want them eating or drinking. So put them in a stall with no food, no water, and no bedding. Even if a horse has an obstruction in their esophagus, unfortunately, they are going to keep trying to eat, and then that will make it worse. Okay, I think I did a very fast run through of the majority of the questions. I know that there are more in there. Did anyone else peek at the Q&A kind of when I was going through this? Was there anything else that got added in?
I think you did an amazing job. And those of you still hanging on, I just posted the email address in chat. If you have suggestions for our next webinar, because we would like to do more of these, and make them fairly focused. We would like to do a webinar on preparing for emergencies like wildfires and floods. We'd like to do webinars on how to make your horse a better patient, how to handle him correctly, how to put eye medication in. We'd like to do one on TPR, vital signs. So if you have suggestions on topics, you can send those emails to horseowners@aaep.org. Those will go to me, and I will pass them along to our horse owner committee. But yeah, we are so pleased to be able to do this, and I think that we can all agree that we should do more. Patience, everybody. I will get the resources and the recording of this video up and available to you. And if you didn't write down the address where to look, it will come in your email from Zoom that says, "Thank you for attending." So you should get it there too. But if you don't get that Zoom email, then check your spam box. So yeah, I love seeing all the hearts and applauses go up through the webinar. Thank you for that, you guys. So very many thanks to Drs. Ali Catalino, Raquel Lindroth, and Nikki Scher. You all put in so much hard work for this session, and clearly it's appreciated. Look at all those hearts going up there. Thanks, guys. We do hope to do more of these. So again, if you have any suggestions for topics, send those along, but don't email about your particular horse's problem. That is what you talk to your personal vet about. So make sure that you have that good relationship with your vet. It can be hard to do, but it's the most important thing for your horse. Thanks to my IT backup, Kevin Hinchman, who didn't get to do anything. Yay, because it all worked. So I think with that, I'm just going to ask everyone to give one last wave goodbye. And then this is the awkward part where I just kind of hang up on everyone. There's no cool way to do this. So look at all those hearts. I'm just going to sit here and look at hearts for a while. That's great. Thanks, everybody.
It's almost
Okay.
like we're live in person watching all the applause right now. It's really
I know,
nice.
isn't that cool? I wonder if that comes over on the recording. Otherwise, people watching the recording just think I'm losing my mind. Okay, there's little emojis going. All right. Time to go. So one more time, thank you, everyone. We really appreciate you joining us, and we hope to see you again. All right, here we go.
Bye-bye. Keep well.
I am hanging up
Bye, guys.
in 3, 2, 1.